timeline restrictions.
Yes? Okay. Okay, I'd like to call the February 19th Human Services Committee meeting to order. First thing I need is an approval of the minutes from January 15th. Do I have a motion? A second? All in favor?
Aye.
This brings us to the privilege of the floor. Do we have anyone here to speak to the privilege of the floor? Anyone to speak to the privilege of the floor? Seeing none, we'll go to our first proposed resolution, which is confirming reappointment for the Chautauqua County Community Service Board.
This resolution is to confirm the reappointment of our CSB Board, Community Service Board, that is a part of our mental hygiene. It's a group of stakeholders that help us make informed decisions when it comes to providing services within the county to the best of our ability.
And this individual is very qualified?
Oh, it's a team, so yes, very qualified. So it's a team of 8 individuals, and it's basically a multidisciplinary team that come from different agencies and also from the community. So we have some nurses, also some therapists as well, and they help provide insight and information on gaps in services that for when we apply for state aid and things of that nature, they have a voice and a seat at the table.
We're appointing one now.
Yes.
Amanda.
Yes.
And it's a reappointment, so. Any questions from anyone? All in favor?
Aye.
Okay. Second proposed resolution, confirm appointments for Chautauqua County Office for the Aging Advisory Council.
Good evening. Dina Corwin, Director at Chautauqua County Office for Aging Services. So we have a resolution put forward tonight to accept a candidate for our advisory council for the Office for Aging. It is a lady by the name of Virginia Harper. I had an opportunity to meet her in 2023 when I was doing some outreach and vaccination work in the north part of our county. The council is made up of different members in different locations throughout the county, and I got a chance to talk to her for a while that weekend and encouraged her to learn more about the Office for Aging Services. She's a great lady. She has got 35 years at ECMC. She's very active in the North County, the Dunkirk area, including her church. She serves as a member, I want to say it's an ambassador, with the statewide Senior Action Council, and she's very qualified. She does a wonderful job as an advocate for the members of her church, which is, oh goodness, I'm going to see the church in my mind, but I can't remember the name of it. It's the oldest church in Dunkirk. Friendship? It's going to escape me, but she's a lovely lady, and she's willing. She's come to one meeting to kind of hear what we do. She's been doing some research on services and programs, and she would like to join the council, and we would love to have her.
Sounds good. Any questions?
Just a comment too, you know, the council has a variety of different individuals on it, and it's also, over the years, has tried to get people from different portions of the county. So
Absolutely.
this is a person from the Dunkirk area, so it's trying to, you know, service that part of the county, so.
Absolutely.
Yeah, that's great.
Okay, anything else? All in favor? Okay, this brings us to number 3, the proposed resolution to authorize lease agreement with SUNY Fredonia for 2025 Senior Expo event.
We have a resolution for you to do a one-day rental of the Williams Center, which is a building on the SUNY Fredonia campus. We are anticipating holding a very large event. Therefore, we needed to find a place that could house more than 800 older adults. In the last several years after COVID, we've been doing an annual event to celebrate Older Americans Month, and we've served about 570 to 600 people between the north and the south parts of our county. Previous to COVID, we'd done a summertime picnic and served 300 to 400 people. As the older adult population has grown, we found the need to really expand the area, and the only place we've been able to find is SUNY Fredonia. They've given us a fantastic rate, a very low rate, and we're working with them to secure a lease, but we need, of course, the resolution first.
What is that rate?
It is $575, which breaks down to $375 for the rental of the Williams Center for that day, and a $200 IT fee for services for setting up. The event will go all day long. It's the first ever expo we've ever offered older adults and their caregivers. The reason we went to a larger venue because we had providers as well as adult, family, and caregivers that would like to attend. We are looking at a vendor fair of almost 80 folks that are interested in attending, and the event will be open to people of any age. So if you're an older adult and you have a daughter or a son involved in your care, they are welcome to come as well. So we're really opening up to learn how to age well in your community.
Does it have Medicare people there?
Medicare will be there. One of the things we're very excited about is not only is the big vendor fair where people will be exposed to programs and services and benefits, but late morning we have some of the Fredonia staff that are offering their talent and expertise in some hands-on events, everything from playing the ukulele to documenting your life bio as an older adult. And then we have plans for lunch. In the afternoon, we'll be doing some breakout sessions, short 35-minute information sessions on everything from depression and anxiety to orthopedic care to Medicare to scams. Very educational. We have a diabetic educator involved. So we're really, really excited. We think it's going to be a fantastic event.
Is this a free event then?
There's no cost to attend.
Is lunch being sponsored by one of the vendors?
We're
or-
working on that, yes. If you are familiar with the CHQ Aging card, and I think I have one here, if you're part of the Dining Out program, which is a congregate program, not only in a couple congregate settings, but also some local restaurants, those people that register can use their CHQ card, and then there's no cost for that meal. Those that we're looking at a couple different vendors. Some will be able to fit that niche and some won't. So there'll also be a cash offering for those people that are under 60 that wouldn't qualify for this, or those that aren't interested in this. So it's
So
really
there's a fee for lunch then for those?
not using the CHQ.
Well-
If you're under 60, there would be a
There would
cash
be,
fee
okay.
for lunch.
Unless it's sponsored or something. I had one question. In the last whereas, it said that all related expenses are included in the 25 budget. So it's budgeted for, but a budget amendment is not needed at this time.
We looked at possibly having sponsors
Okay,
for the event, and that's what we're working on now. So we
Okay.
anticipate that there shouldn't be any cost to our budget.
okay. But there could be,
We don't anticipate it.
okay. Any questions? Any other questions? Concerns? All in favor?
Aye.
Aye.
Thank you for that.
Okay, proposed resolution to amend 2025 budget for purchase of van for meal delivery for the elderly.
Yes, this resolution came about because our North County delivery system has an aging vehicle that needs to be replaced. So in the conversations in and around that, we realized we needed to do a resolution with a budget amendment. So we have some funds outlined on your page there The expected cost of the vehicle, cargo, transportation vehicle for meals would be $42,000. There is $19,000 in a fund already that's been growing since 2019 for this purpose. And our plan is to look at our grants to finance the rest of that, which should be $23,000. So we're looking at replacing a 2016 cargo van. As my husband would say, it doesn't owe us anything. It's done a great job. We have we have 2 vans there, but they cover a large area in the north part of the county. And we anticipate using our federal funds for this under our 3C funding.
Is there any trade-in value to the existing van?
My understanding is that when they're replaced, that the van comes back to the county, and I believe DPW or the fleet manager makes the decision on the asset value and then how to recoup any funds. So yes, there should be, although I have no way to know what that amount would be.
Thank you.
How many miles on that 2016? I'm just kind of curious to how much driving.
Oh
they
goodness,
actually
you
do.
know what? I asked. I'm not sure. I'll have to look into that and get back to you. Was that you?
I'm just kind of curious of
Yeah.
how much driving they're actually
I'm not
doing.
sure. I did call today to find out the year, but I don't think I have the mileage for that.
I'm just curious if it's sitting more than it's being driven.
I think they're on the road a lot.
They drive a good bit.
Yeah. Go ahead.
So would this currently deplete the fund for van replacement, so it would be 0? And moving forward, is it within the budget to start rebuilding that? In what year is van number 2? So that way, I'm just trying to.
I think van number 2 was 2018 when I looked it up on the contract.
So really in a couple of.
In a couple years,
Really, in a
there
couple of
could
years,
possibly
van would be
be
the other
a
one,
need
yeah.
for that.
Yeah.
Right now, with the current contract, there is what's referred to as an encumbrance fund.
Mhm.
So a portion of every delivery is put aside
Yes.
for that particular project.
Yep. They have another van also that they use down there? Is it just one? And they-
We have 2. They have one of their own.
Okay, yeah.
Is the van ordered? Is it in stock?
I think it's hovering. I think they've identified it, and they know what they want, and they've been working with the fleet manager.
Because if you order one now, it might be more than
It
42,000.
could be. This was just a couple weeks ago when we put in the resolution, when we knew this was coming up quickly.
So you're confident it's going to be 42, it's there, and, okay. Any other questions? All in favor?
Aye.
Opposed? Carries. Number 5, proposed resolution to authorize acceptance of lead hazard reductions.
Thank you.
Thank you, Dana. Grant fiscal year 2024.
Good evening, folks. I'm Jessica Worsley, Chautauqua County Environmental Health Director.
I'm Anna Powell, and I'm our Childhood Lead Poisoning Coordinator.
So this resolution is to accept and celebrate the good news of us being awarded the U.S. Department of Housing and Urban Development grant, which helps us address the lead hazards that exist in many of our Chautauqua County homes. So it's a fairly large amount, over $5 million, and that $5 million will carry us from January 15th, 25 into January of 29. That money is used largely to help fix the problem areas in homes that cause lead poisoning.
This is not for 14701 only. This is a countywide.
This is a countywide, yep, this is a countywide program. It's kind of a continuation of our current HUD grant. We partner with Chautauqua Opportunities. So we do have some funds available for our department, but most of, over 85% of the budget is to provide lead hazard remediation. So most of that goes through COI to be able to bid out approved contractors to bid on our projects. We replace windows, doors, and do the big permanent fixes that these homes need.
And you say 85% of this
Is direct costs,
is in the home,
yeah,
and the other 15 is administrative?
is just administrative well, we do have a good budget for training new contractors and paying, trying to build that workforce development. So we're always outreaching to our contractor pool to get more contractors lead abatement certified, their workers abatement certified, and their renovation and repair training. Those certifications, they take a while to get. Some of them take a little while to get, and there's big fees associated with them. You know, contractors would have to pay for the trainings up front and their EPA certifications. So we put, knowing that workforce development is huge in our area for this, our projects, we really put a lot of time and effort into outreaching to our contractors and offer them you know, reimbursement for their EPA fees. So, yeah, we have, you know, other items in there that we're able to use funds for.
Is it hard to get contractors?
It can be.
We have, so for example, with our first HUD grant in 2020, we started off with 2 approved contractors. We now regularly have 7 contractors bidding on our projects. So I think we've done a really great job at, you know, outreaching and getting more contractors on board. Again, with the rental registry, there's never going to be enough contractors, but we're still always you know, providing outreach and trying to give them the assistance they need. It can be really costly to train a lead supervisor, and then all of your workers need certifications too. So the costs, you know, we really try to incentivize them by, you know, paying for those certification fees for them.
And the importance of that is when we've identified the lead hazards in the homes, you can't just have anybody waltz in there and start doing things. They need to be trained in lead-safe work practices, so they're not making an existing problem even worse in the course of correcting it.
And their own safety, I'm sure.
Yes.
Personal protection is
I
always
think my
important.
14701 question was really skewed towards the lead rental registry. I got them mixed up, I think.
Yeah, I mean, and over 75% of our kids that are lead poisoned in Chautauqua County are in that 14701 zip code. So a lot of our work is in, you know, but we do have, you know, a lot of older housing throughout the whole county. So we really try to make this funding available countywide, but most of our work is done in Jamestown.
And there are income criteria tied to the availability of these funds.
Well, that's what I was going to ask. What's it take to qualify? Who qualifies?
Yeah, so there's the income threshold. I'm not sure what the numbers are.
Yeah, income thresholds are set by HUD every year. So for our grant program, we have to ensure that a certain percentage of the families are under the 50% median income. I'm ballparking a number off of HUD for 2024 numbers, and I think our median income is maybe $70,000 for our area. So it does go by area. It's not blanket throughout the whole country. So it is for Chautauqua County. And then we can also offer services to people up to 80% of that. So, you know, when you have, and it does go by family size as well. So, you know, sometimes if you have, you know, a couple of children, which children are a qualifier as well, we have to have kids under 6 in the home to be able to remediate. But it's a pretty generous amount. So a lot of families that need services do qualify.
Do owners of rental properties. In the first whereas it said owner, but like, I guess my concern is like out-of-town owners who don't care to qualify, where then someone, a family in wherever, you know.
Yes.
Or whatever wouldn't qualify and they would get it. And a bank.
So we do have to, I mean, landlords still have to be part of the process. They have to submit an application, they have to submit their insurance, they have to submit all of the things, and the properties have to be up to date on taxes, right? So we're not offering services to slumlords that aren't paying their taxes. And if they want us to go in and put 20 grand into their house and have all new windows, then they have to make sure they're caught up. They also have to retain that property for 3 years. So a 3-year lien goes on that property that says if I sell it, we recoup the money. It goes back into our lead hazard remediation fund. And they also have to give priority to rent to families with children under the age of 6. So there is a little bit of skin in the game for the property owners as well.
So the median, or the income requirement is for those that are the current occupant?
Yes, income requirement is for the tenants.
Oh, for the tenants? not-
Yes.
Oh,
Yes, so landlords don't have to income qualify. The service is actually going to the tenant.
yeah, but the improvement's going to the owner.
I wouldn't say it's a safety issue.
It is.
But, yeah. Yeah, I mean, we can split hairs on that, but that's, the service is going to the tenant, so the tenant's income is what we base off of.
And we certainly hear your point, because we have concerns about the quality of some of the landlords renting these properties and their ability to maintain them as safe housing units. But
We also require that landlords have, so if they are an out-of-state landlord, they have to have a property manager on file, and that property manager and their team have to be RRP certified in renovation, repair, and painting, so they can make sure they provide lead-safe ongoing maintenance to that unit. So we train a lot of property owners too. If they don't have a property manager, then that landlord also has to have their RRP certification.
Yeah, and I understand the safety of the tenants, but, you know, I got an owner that can afford it, to do it. When you got somebody else that can't afford it, and their safety is just as much important.
Yeah, I mean, but I think it
We-
kind of goes many different ways. Sometimes it's,
so we also frequently, these units are identified when when a child with an elevated blood lead level has been reported to us. So these are situations where somebody needs to get in there and do something quickly. And so this program helps us facilitate that.
Does that happen pretty quick if some child is found to have lead in them and then it's reported? How quick does that?
now that we have all of our staff on board, it's, our first 3 years was definitely a building grant year, and we have a lot of experience now. So right now we have qualified properties waiting and ready to just start feeding into the pipeline. So I expect everything to move a lot quicker than it did in our previous grant year.
So is the child still
We-
maintaining that apartment, or did she get
Yep.
removed? Did she get removed till that work gets done?
No, so we don't relocate families immediately. What we do is we work with that family to provide interim controls, so dust control and really good cleaning practices. And we work with the families on that immediately, because that is a tenant responsibility. Hand washing, good nutrition for the children. We have a nurse on staff that also provides care coordination for these families, to help kind of reinforce those good habits. And then sometimes there's things that we can do, we can put plastic up on windows and create barriers until we can get in there and make those permanent fixes.
So we're required, when a child is tested for lead and their number is high, we are notified through a New York State system that a child has been identified with a high level. And we are required to follow up and make contact with those caregivers in a very short amount of time so that we can get this process moving, so those children can be helped as soon as possible.
So who contacts you? Does the doctor's office when they discover it?
It's a state system, so the doctor's office inputs the numbers and the results into the New York State tracking system, and then we are notified via that system of an individual who has tested high.
I have a couple questions. I share some concerns with Marty also on just, and I'm sure your office over the years has figured out who the good landlords are and who are not, you know. And sometimes, you know, I think that your department will figure that out too. I agree, you know, you don't want to put the money into some of these places that it really, you know, just to have it go to waste, or there's better options to put the money in. But, you know, I guess that's the administration that, you know, will trust that your office, and also the requirements kind of pan out too. There's a lot of requirements to kind of supersede that, because it's not alone to our area.
Absolutely.
Yeah. How many children in 2024 were identified as having high lead levels?
I believe 76 in our county.
Okay. Is that average?
Yep.
You know, it'll be interesting to see those numbers, and the hope is it declines. You know, hopefully in 10 years from now, it's 36, you know.
Well, yeah, I mean, we definitely are optimistic that some of the changes that we're making, for instance, with the remediation and versus the abatement that we're doing, you know, we used to allow that windows could just be painted over, but we have changed that policy, and now windows can't simply be painted over. You have to get rid of that lead paint completely by stripping it down to wood, or completely replace that window. We have seen the reoccurrence in a number of these properties, and so we have been making strides in a better long-term full abatement type process, so that we're not seeing these same problems turn up again and again.
And really,
We-
that rental registry
Yeah.
is the best proactive, I mean, really, it's just a proactive rental inspection, right? We don't have, nor have we ever had any policy like that within Chautauqua County, within Jamestown. And that is proven method to reduce childhood lead poisoning, is to have reoccurring lead inspections in rental units.
And we do have, so Marty, you mentioned earlier that you were mistaken with the 14701 zip code. And I'm actually kind of glad, because we do have so many good lead things going on right now. Because, you know, that's evidence that we've got, you know, our response to the elevated blood lead levels. We have this rental registry coming. You know, we've got this source of HUD funding to use for remediation. We have the HCR grant that we're using for remediation. And then we're also doing preventative inspections throughout the county for any new expecting parents or parents with young children who invite us into the homes to do all of these different inspections. So there's a fair amount going on, so we certainly are hoping to see those average numbers of kids that we're, you know, testing high for lead every year. We're certainly hoping to see those start going down.
So there's a number of programs where when I screw that up, it isn't a big deal, because
No, it's okay.
We're happy you're confused. That means we're doing good things. There's a lot going on.
exactly. And I can screw things up pretty easy.
And just to be clear, the wet rental registry does really put the onus on the landlord.
Correct.
That is the program that really does require the landlords to step up and remediate, so that the dollars aren't going to basically subsidize bad behavior.
But when the lead rental registry prompts that owner that you have to do something, then that owner says, okay, I want a piece of this.
Well, but again, there's also the caveat that the rental registry is for all rental units. It doesn't matter if there's children in them or not. Our grant funds only target homes with children in them.
Oh, this-
So there's been,
okay,
yes,
okay.
so there's also been a big narrative amongst the landlords of, oh, well, we're just not gonna rent to children. Well, that's fine, but you don't get any help
Okay.
either. So all of our grant funds are targeted towards
Family.
families with kids under 6.
Okay, and I know that was one of the stipulations, but again.
There's a lot. There's a lot. Yeah, there's a
String the
lot.
two together, so. Okay. Anything else? Any other? Okay, all in favor?
Aye.
Aye.
Thank you.
Thank you, folks.
Thank you. Thanks for all you're doing.
That 76, is that in Jamestown or for the whole county? 76 children diagnosed with lead.
County.
I'm pleasantly surprised. I would have thought the number would have been higher.
Okay.
lead paint was banned in 1978, so.
I remember when they did I remember when they did the painting, and that was like, because I had rentals back then, I thought, what a joke, this is only putting a Band-Aid over the problem.
Yeah, that's,
Painting
I
over
mean, and you can kind of take it into context. I mean, that's 70 kids a year is 5 classrooms full of kids that could potentially need special education, extra.
Well, how do they even get
services.
tested to begin
Oh,
with?
no.
Because I'm sure there's more kids out there, because
Around
Jamestown's full of rental property with lead paint.
Right,
Trust
so
me on
in
that.
New York State, yes,
Okay.
sorry. All kids in New York State should be
I
tested
remember
at
that,
one.
Marty.
Okay, we'll move on to proposed resolution number 6. I guess I should have got close to the microphone. New York State Office of Mental Health, additional funding to 2025 state aid.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services, and this is an award that we received here in 2025 to implement mental health court navigators within our court system to help us with mental health. I just got off the call this afternoon with the Office of Mental Health. The program is officially to start in July, but they gave us the money ahead of time, and they're excited with the plan that we proposed, and they're excited to come down and see how it works. We're hoping that this helps us not only with our 730s, but also helps us with our MAP program from the jail and following the continuum of care, but also identify the gaps in the services, and also to treat people and get them to where they need to be treated if they get released right there or they just get an appearance ticket. So the state has identified that there is a gap within our court system as well, and the mandates that they put, but also from our end as well, the mental health.
Is this for incarcerated people only, or you just said that, I
Yeah,
think?
and it could help. So, for example, we do have incarcerated individuals that at times they show up to court and get released immediately right there. So we lose track of those individuals when it's time for them to follow up for their appointments. These court navigators will be able to capture them right there and be able to connect them and also do the follow-up in the continuum of care.
And this should help that 730s.
I'm hoping.
Any questions?
Nope, I support any program that uses the words continuum of care, because it usually means it's gonna work. Thank you.
This is broken out 51,630 a year. Is that the total cost of the individual?
Well, so what we did, we got creative. So good news is that one of the pieces that we want to put in here is what we call a care coordinator. So we already have some in-house, so we already have clinic revenue. So this way we can make it last longer for when we contract out for the peer. So we didn't want to look at it from short term. We wanted to maximize the dollars and make it long term. So that's why we broke it down that way.
Okay.
Did you say year? Because it's quarter, 51 a quarter.
Okay. Yeah, 51 a quarter.
Yeah, the total is $206,000 for the program.
I thought you
Yeah.
said year.
Yes, I did, and it was, do you feel that this would be a continual program?
Yes, from the conversation that we had today, they were very excited in the questions that I proposed and suggestions, like speaking to the Office of the Courts and getting them in and giving them training, speaking to the Department of Justice as well and giving them training from their end, but also in the collaboration and meeting with the judges due to what their mandates are. So this way we could identify the population, that 1 to 2% ahead of time. So I do believe they're excited, they're super excited, and I do believe it will be continuous from the Office of Mental Health.
You think this is a result of your lobbying efforts?
110%.
Thank you.
the state has quite a bit of cost incurred in this same program also, so hopefully this is enough, and hopefully we can see some action, some corrective. Hopefully we can see, you know, the program is very costly, and I hesitate by saying costly versus, it's definitely needed, right? And so that fine line of just, you know, functioning properly and where the people are getting the care they need at the right places, but also it's monitored a little better, you know, and so that it's cost effective too, because at the end of the day, it is expensive, not only for our county, but for the state in whole, and all the other counties. So hopefully we see some change in all of that, so.
Hopefully, the goal is that we show the wins early, and by showing these wins, we are able to obtain further funding and able to scale the program, not only for our county, but across the state.
Okay, any questions, concerns, comments? Okay, all in favor?
Aye.
Aye. Thank you, Chris. Okay, next up is number 7, to amend the 2024 budget for year-end reconciliations for public health. We'll have to amend this by substitution. Right, Lynn?
Yes, you got it.
This one and the next one.
Do we want to do that now, right?
Yeah.
So I'll make a motion to amend by substitution for the new one that's been distributed.
I second that.
Second, all in favor?
Aye.
Okay, aye. Okay.
Hi, I'm Diana Songer, Deputy Director of Finance for Human Services.
Dr. Mike Falk, Chief Medical Officer.
Lacey Wilson, Public Health Director.
This resolution is to amend the Public Health 24 budget for year-end reconciliation due to expenditures exceeding the budgeted amount. Additional revenues and a surplus of appropriations help to offset these expenditures. We are requesting an increased use of fund balance in the amount of $960,920 and to change the 24 budget to increase appropriation accounts totaling $2,143,913, decrease appropriation accounts totaling $206,268, and increase revenue accounts by $976,725.
So I'll start off quickly, and I'll turn it over to Lacey, by saying this is a resolution that we, as leaders in the health department, anticipated throughout the latter half of 2024, and probably on more than one, at least several occasions, have discussed some of these headwinds that we were looking at with you folks, with Human Services Committee and Audit and Control Committee, and through our budget prep for 2025, mostly having to do with some of the transportation costs that are completely out of our control for these mandated services. So I'll turn it over to Lacey to kind of talk a little bit more about that.
First, do you have any specific questions that I can answer? And then I'll also give kind of a broad sweeping overview, but I want to make sure I answer anything.
Let's do the broad sweeping first.
Okay. So in terms of the contractual costs, really what we're seeing, so just to reacquaint you quickly with the programming, so these are state mandated programs, specifically children and youth with special health needs. So these are children that qualify for additional service needs for a school day. And really the best approach, the most economical approach to serving these children are integrated classrooms within each of the school districts. We do not have many in the county that have integrated classrooms or classrooms on site. We have 2 really. Jamestown school districts have some classes in Westfield. Otherwise, these children have to access services at specialized schools. So there is cost, a tuition cost with each one of those, students that we send, upwards and over of, $21,000 for just aid services alone, if that child needs a one-on-one aid. Then transportation costs, as Dr. Falk referenced, are also necessary then, so we have to contract with private transportation service to provide transportation from the child's home to that specific school. And oftentimes, the schools are located near or in the North County, so if you have a student from the Southwestern School District or the Bemis School District, they have to be transported from their home to the North County to, Buffalo Speech and Hearing even, we send children to as well. The anticipated costs that we really, knew were coming, but we didn't know to what extent, and this predates my time really, at the health department, but the staff has done a great job in kind of briefing me and educating me in this subject. But with COVID, these services in schools obviously were shut down, and these evaluations for students weren't taking place. We also know just nationwide that we've seen delays in children, specifically with special health care needs and developmental needs during the COVID years. So now we anticipate that over the next 5 years in particular, there will be a large number of kind of catch-up referrals that take place. So just to highlight, last year, actually I have the numbers. Last year, the referrals to the number of students attending a special program were 561 for the year. At this point, to date, as of February, because these programs typically run January. Are these the ones that run January?
I think it's school year.
The school year, right, okay. So September, basically, to July really is what we look at. We're already at 522 students as of February. So we're already outpacing last year by a large amount. So these rates are set by the state because it is a state mandated program, unless there is an agreement with a local school district, and then we actually do have the ability to set those rates locally, local school district, local program. So our advocacy work that we're doing at the state level, and this isn't just us in this boat, this is all of the counties across the state, really advocating for school districts to build out classrooms within their schools and also take on the transportation of those. We see, a major reduction in the cost of transportation if obviously the school can integrate that right into their own bus runs. There are added needs, of course, on those buses, and so school districts have been hesitant to jump on board in the past, but the state is making some nice strides in these conversations with state ed at this point.
Question, sure. This program, the county sets and makes this budget. How could we underestimate to this extent? And it's a challenge because it's probably a moving target and you're guessing, but even at that, it still is a pretty decent miss. So how do we avoid this for future things? And I know that there's been some work in some of the schools towards this program already, and we're putting in people also that can help identify these needs. So it's good that we're identifying these needs, but this is a aspect of seeing those inputs also. So, at the end of the day, it's needed and necessary, but also we need to make sure we are budgeting properly.
Yeah, very much heard and understood in the 2025 budget. I think we've right-sized the estimations there, have a much more appropriate kind of estimation, also based on the fact that we've had a year to see really kind of where that growth was out of COVID, kind of those catch-up numbers, what that looks like. That was a pretty large leap. I don't have as much of that history for the 2024 because I really wasn't here at that point, but in 25 I feel like we have a good handle on that number, and was something that since we had talked so much about it in previous committee meetings with you all, that you didn't blink an eye at it in this year's budget, which was great, because I think you all are understanding too, along with us, that these numbers are growing, and we're doing our best to forecast them so that we don't end up in this situation next year.
I remember discussing it, and I don't remember the details, but I am a little confused. You said there was 561 referrals last year and already 522. Is that for the school year, or is that for the calendar year?
It's for the school year, yeah, so the
So if
referrals,
we're at 522 now, it's really not that far off from last year, because we only have 2 or 3 months left. Seems like all the referrals would already be
so they.
looking forward.
Yeah, they come off, so what happens is there are summer programming that still will happen through
Okay.
the summer, but it is smaller numbers. It's just the fact that we are seeing now a much more elevated caseload as well. So these students that are coming in, they are coming in with higher needs. So like I had referenced aid service. Not every child who utilizes this program requires an aide to be with them on the bus, or we are seeing more often one-on-one aides needing to be placed. So that's an additional $21,000 approximately dollars, for tuition for that year for that
Per student.
child. So just the costliness of these referrals is really what we're seeing kind of skyrocketing. And then just the contracted costs. So the cost for the specialized schools, those increase year to year as well. So I think over the last couple of years, we've seen a good $5,000 per child increase rate in tuition for each one of the contracts.
And most of those contracts in the schools are in the North County.
Yeah, so,
Someone in Panama, Clymer, Sherman has to go,
yes.
child has to travel all the way north every day.
Yep, and we have to do the private transportation contract with them, yeah.
I mean, that's not good for the child to be traveling an hour.
No,
2
and
hours,
it's,
hour up, hour back.
Imagine a school bus ride in the middle of winter and, for 35 minutes, it's a task.
Yeah,
Mhm.
because I don't think in a local school district of,
You'd be surprised at how many kids are probably going in a lot of different places.
Yeah.
It's a lot.
Mhm.
A lot of kids are going different places, and it is expensive to do that.
Yeah.
And we're seeing the cost, not only just the transportation headache, but the facility, and the facilities, they have their expenses that are going up too, so our fees of utilizing
Right.
those are probably going up too, and there's probably some of that in here.
Right.
Uh,
That's why really that kind of person-centered approach of having the school districts, with classrooms on site and doing their own transportation, it just improves the service for the children. It is so much, so much of a cost savings to the county. So Westfield, again, they did have a classroom, and they were doing transportation on their own. They ran into a bus driver shortage, which has happened also across the county and nationally as well. But while they were doing that, we saw a cost savings during that time, just in transportation costs alone. And again, it just serves the children and the families much better as well.
Are the regulations good, or is it over and above? Over and above could add the extra cost of the needs. I mean,
Right.
Is that
So,
reasonable?
This is one of the programs that I feel is reasonable, and I do understand what you're saying, especially from New York State DOH. We're, very highly regulated, kind of agency. This is one of the ones where, because they aren't providing medical, practice or medical services to the children, it tends to be much less regulated in that sense. So if there were something where it was, a personal care aid where, a nurse was coming and taking care of the child and providing medical, necessary services, that would be one thing. But really, they would provide those services, medications and things like that happen in the school that they're going to. So more of that state oversight would happen under the kind of that clinical aspect of services. So, no, really, the services that are kind of driving some of the costs that you would think that the higher costs would be driven by
the special services that they receive in terms of physical therapy, OT, but really those services are kind of undercosted in this program, and has become an issue where we are losing service providers because, other states provide rates at, a much greater extent. So you can't even really justify it there in terms of, oh, maybe that's why these costs are ballooning because PT is so expensive. No, a lot of these physical therapists and OTs are providing the service well under what they could get in another state. So it really sort of has to do with the fact that this is kind of centralized and become more of a universal program than a localized program, which we know that from, county government costs a lot less than a state government does.
Are some of these offsets vacancy savings?
So the personal services under public health admin, I think, are mostly vacancy savings.
Okay.
The contractual cost for medical examiners and coroner program was overall over 2024, we saw a reduced number of deaths, specifically drug overdose deaths. So those are the reduced contractual costs there. And then the increased appropriation for the jail really has to do with we had several individuals receiving high-level specialty care throughout 2024 various times. Just due to HIPAA concerns, I can't get into specific cases, but they required high-level specialty care due to illness or injury, typically prior to incarceration, and that care needed to be continued. So that's kind of where that came from for the most part. So.
And actually, if I could just hop in really quickly, I just pulled up the budget performance, overall in that contractual classification over the last few years. So in 2022, that contractual was basically what the 2024 budget was. So it was just over $8 million. Now, when the 2024 budget's made, obviously, in the middle of 2023, it's based on that full 2022 year's actuals and then leading up to that point in 2023. So they were probably right on par with that when they created the 24 budget. But the way that 23 flashed out, it was about $700,000 more than 2022. And then the difference from 23 to 24 was $1.4 million is the difference in actual numbers. So that variance actually doubled from one year to the next. So that just kind of goes to show how much the uptick in those needs and those costs actually really are reflecting to be for the department.
Any other questions? All in favor?
Aye.
Aye. Thank you.
Thank you.
Okay, resolution number 8, proposed resolution to amend the 2024 budget for year-end reconciliations for the Veterans Service Agency. And a substitution on it.
We also, I'd like to make a motion to amend by substitution, different resolution for this one also.
Second?
All in favor of the substitution?
Aye.
Aye. Okay.
Hi, Diana Songer, Deputy Director of Finance for Human Services.
Greg Carlson, Director of Veteran Services for Chautauqua County.
This resolution is to amend the Veteran Service Agency's 24 budget for year-end reconciliations due to expenditures exceeding the budgeted amount. Additional revenues and the surplus of appropriations will offset some of these expenditures. As a result, we are requesting an increased use of fund balance of $5,465 and to change the 24 budget to increase appropriation accounts totaling $22,350, decrease appropriation accounts of $4,491, and increase revenue accounts in the amount of $12,394. The contractual expenses were higher than budgeted due to additional expenses related to moving into a new office space and additional vehicle expenses for Veterans Van.
Okay. Yeah, primarily, when we made the move in January of 2024, We had to occupy 2 places for a month because of internet connectivity. So $3,775.32 was spent on fiber optics install, and we actually share that with, not the cost, but the fiber optics install with the Mobile Crisis folks who are in the same building, and then the contractual overspend of $2,624 for the electric install. This was unanticipated based on the move, and I don't foresee a problem in 2025 because the move is complete and we're now steady operations. The fiber optic install and the new communication suite has been very good and has decreased a lot of the work stoppages we used to have due to connectivity issues.
Okay, any questions on this?
You said there was also monies that went into the van?
Oh, yeah.
So yeah, the veterans van is aging.
Yep.
It's 2016. It has over 200,000 miles on it at this
Yep.
point. So just unexpected maintenance costs. More than likely, the van will be retired June 1st, just because they're trying to keep it going that long right now for carts. And then that will cause a decrease or an adjustment to the 2025 budget.
Will the van be replaced?
Van will not be replaced.
Why?
Because I have all the data that I got from carts, and basically the number of riders we've had has continuously decreased. And we're down to probably a third of what the ridership once was. They were only operating 2 days a week. And ultimately, we don't have $250,000 to replace the van.
So that service will be covered by carts then, or CHQ Transit?
So the veterans van is kind of a unique thing to Chautauqua County, meaning most counties who have a veteran service agency don't have a veterans van. This is something that started probably 20 years ago with a van that was donated. And then when Senator Young was a state senator, she procured a grant that replaced the veterans van. And normally, transportation for veterans to healthcare facilities is provided by the DAV, the Legion, whoever has it. So it's kind of unique to us. So in this situation, we just don't have, the ends doesn't justify the means. So basically, the cost for the amount of riders that we have just doesn't justify purchasing, basically what would match almost our annual budget to purchase a van. Plus the maintenance and the driver and everything that goes with it, so. We do have some alternative things that we're working on for the case-by-case basis that veterans do need transportation. But most of the time, the veterans who are using the veterans van now are using it as a convenience as opposed to a need. And I'm not diminishing any veteran who's using the veterans van, but we typically have the same 3 or 4 riders weekly.
Okay. Anything else? Any questions? All in favor?
Aye.
Thank you.
Thank you. Do we have anything other? Okay. Motion to adjourn.
Make a motion to adjourn?
Second?
All in favor?
Aye.